and other mediators of inflammation, you're going to limit tissue destruction. So if you have an overproduction of histamine, the tissue is going to become more inflamed. So we try to reduce the inflammation, and quercetin is one good way to do it. Clinical studies on bromelain, kind of funny. All my ladies that come in and get their eye jobs done, or their breast enhancements, or facelifts, the doctors are recommending, besides arnica montana, bromelain. There's clinical studies to show it's a reduction in bruising, healing time, and pain following an injury, because it is an anti-inflammatory, but you have to have the right kind. So usually 500 to 1,000 milligrams with what's called a high GDU level. That's a measurement, an energy measurement unit that makes it active. On an empty stomach a couple times a day really can reduce the inflammation. Turmeric, anti-inflammatory. I know even Dr. Rosenfeld on Fox News a few weeks back was talking about substitutes for drug anti-inflammatories, and turmeric or turmeric extract, which is also known as curcumin, have an extreme anti-inflammatory response and reduction of inflammation. Serrapeptase enzymes. If you got a chronic issue, I tell you, I had a chronic hip issue with tendonitis in my hip. I did some trail running marathon training, and I tell you, it was causing issues. Stopped it. You know, I did in the right dosage. It just helped eat up the scar tissue, reduce the inflammation, and very helpful. Good multiple vitamins should always include some zinc and some natural vitamin E, which always aids in beds healing. And you know how with plastic surgeries they always recommend vitamin E for scars. Well, guess what? Vitamin E on the inside also helps with scarring and inflammation and healing, along with zinc as well too. Anyway, I hope that's helpful. Any questions, you can always stop by the vitamin herb stores and get copies of these, and we have them on hand. Next, we're going to be moving on to the fitness portion of our show, where I'm going to show you an exercise for plantar fasciitis. Thank you. Hi, welcome to the fitness portion of our show, and I'm going to show you an exercise that was recommended, and we'll get it right here, by the American Academy of Orthopedic Surgeons. And this is a stretch that you should perform when you're seated. And basically what you're going to do is you're going to grab your foot, and we can hopefully get a little bit of a close-up, and I'm going to pull my ankle up and my toes towards the front of my leg here. And I'm going to take my thumb and I'm going to massage down in here. This is for plantar fasciitis. You have a tendon right in here that can get injured. You're going to hold that and rub that for like 10 seconds. Allow it to rest. And the surgeons had recommended that you do this anywhere from 10 to 20 times at a session. So that's going to take you a few minutes. They recommended it doing first thing in the morning, and then whenever you're seated for long periods of time and that can get stiff and tightened, do that massage or right on that plantars, and hopefully maybe that will help. It can help speed healing as well as reduce some pain. Next, we're going to be moving on to the research portion of our show. Thank you. Hi, welcome to the research portion of our show, and with us today is Ralph Turchiano.
And thank you for that intro. Well, this one goes in the categories of everything your doctor may have told you about certain things may be wrong, or at least not exactly helpful. Well, coming out of the American Society of Nephrology's 43rd annual meeting and scientific exposition came a subject called elderly can blame fractures and falls on low sodium. This was a Dutch study. What they did is they took 5,200 Dutch people at the age of 55 or older and followed them for about 6 years. Now, about 8% of these Dutch individuals had something called hyponatremia, which really means dangerously low sodium levels. This particular group happened to be people which tend to be diabetic or taking especially diuretics, which a lot higher percentage of the people in the U.S. seem to take than the Danish. So what we discovered was this. Those which had low sodium levels in the blood compared to those that did not have low sodium levels, the low sodium group fell 24% of the time compared to those which had regular sodium, which was 16% of the time. Now here is the kicker. The subjects with hyponatremia, low sodium, had a higher rate of fall during the follow-up, but also keep in mind there was no difference in bone mineral density. There was no difference in osteoporosis rates one way or the other. But the group that fell that had the lowest sodium had 61% higher number of fractures than those that had normal sodium levels. Also, the risk of non-spinal fractures, such as hip fractures, was also significantly higher. It was 39% higher compared to those with normal sodium levels. And overall, now here's something else to take into account, the people with hyponatremia or low sodium levels was this. The relationship between hyponatremia and fracture risk was independent of the increased rate of falls in the low sodium group. The subjects with hyponatremia, low sodium levels, had a 21% increase in the risk of death from any cause during the follow-up for over 6 years. So, is salt a good thing or a bad thing? Well, that's for you to determine. But however, salt being overly low, obviously a very, very, very bad thing. Something for you to consider with your doctor, especially if you're doing diuretics. A 21% increase in death from all causes, not just the 61% increase in fractures, the 39% increase in spinal fractures, regardless of bone density, just because of low sodium, is something worth you investigating with your doctor. All right, now let's go to people with dialysis, so people with chronic kidney disease. Now, this is a little interesting side note, and it happens to do with pomegranate juice. All right, this is what they did. Again, from the American Society of Nephrology's 43rd Annual Meeting and Scientific Expo that's in Denver. All right, they followed 101 dialysis patients, gave them either pomegranate juice or a placebo, and they only had them drink it 3 times a week for 1 year. All right, this is what they discovered. This goes up a good thumbs up for pomegranate juice overall. Laboratories tests showed that patients who drank pomegranate juice experienced reduced inflammation. Remember, these are kidney dialysis patients. And the damage of oxidative stress caused by free radicals was minimized. Furthermore, pomegranate juice drinkers were less likely to be hospitalized due to infections. Now, there's no advertisement for pomegranate juice in here. This is an independent study. It is also revealed that those who drank pomegranate juice also showed an improvement in cardiovascular risk factors, such as reduced blood pressure, improvement in lipid files, and fewer cardiovascular events, such as heart attacks and things like that, suggesting they had better heart health. And the authors of the study also put a note at the bottom of this research. Considering the expected epidemic of chronic kidney disease in the next decade, further clinical trials using pomegranate juice aimed at reducing the high cardiovascular mortality rate of chronic kidney disease patients and the deterioration of end-stage renal disease should be conducted. So, one way or the other, something you may want to consider with your doctor, just 3 drinks of pomegranate juice for an entire year was enough to get pretty significant results. So, something to think about, if not add to your daily, nightly drink. And now, one for vitamin C. Do you realize there's really no good treatment for sepsis? And severe sepsis itself has a 40% mortality rate. Well, ironically, the University of Western Ontario and the Lawson Health Research Institute found one powerful tool to prevent, and what they said, the onset of sepsis and also reverse sepsis. What is this amazing pharmaceutical that's out there? Vitamin C. Possibly one of the first treatments they actually have now for severe sepsis. They said, again, severe sepsis has a high rate mortality rate nearly 40%, and currently there is no effective treatment, i.e., except now. Through his research, Dr. Tamil discovered that a single dose or bolus of vitamin C injected early at the time or induction of sepsis prevents the capillary plugging, the clotting that occurs. He also found that a delayed bolus injection of vitamin C can reverse plugging by restoring blood flow of previously plugged capillaries. Something pretty amazing for people that have sepsis. Our research in animals with sepsis found that as early as well as delayed injections of vitamin C improved the chance of survival significantly, explained Dr. Timmel. Furthermore, the beneficial effect of a single injection of vitamin C is long-lasting and prevents capillary plugging for up to 24 hours post-injection. The potential benefit of this treatment is substantial. Vitamin C is cheap, safe, and effective. Previous studies have also shown that it can be injected intravenously into patients with absolutely no side effects. Now keep in mind, we did a research article a little while ago about the number of acutely ill patients being admitted to hospitals that already had scurvy, meaning severe vitamin C deficiency. So obviously, something so simple and so cheap and so abundant can prevent such a life-threatening disorder in infants and the elderly or anybody else with a compromised immune system. Somebody out there is not getting adequate levels of vitamin C. This is a vitamin that could save your life before you even know it. So think about that. All right, now we go to something which is kind of interesting. It's also something in regards to light. A lot of us like to sleep with the night light on or have some sort of dim light in the room. Well, doesn't appear to be too good for mood, or I should say depression. What they discovered was this, and this was on the November 17th, that will be released on November 17th, was the annual meeting of the Society of Neuroscience. Exposure to even dim light at night is enough to cause physical changes in the brain of animals that may be associated with depression. This is the first time researchers found that light at night by itself may actually be linked to changes in the hippocampus. All right, they said even dim light was sufficient enough to provoke depressive-like states in animals. The results are significant because the nighttime light used in the study was not bright, what they call 5 lux, or equivalent of having a television on in a darkened room, and only took about 8 weeks to trigger these depressive symptoms. What they discovered was this. The results showed that animals living in a dim light had significantly reduced density of what's called dendritic spines. These are hair-like growths on the brain cells which are used to send chemical messages from one cell to the other. So dim light actually reduced the body's ability to repair, create new dendritic spikes, and also communicate chemical messages to other parts of the brain, therefore resulting in depression itself. Intriguing. So if you can sleep totally in the dark without being scared, it may actually do something quite significantly to improve your mood. Well, I guess we're reaching the end of our segment, and thank you very much for that.
Thank you very much for joining our show. Do your research, especially since we said vitamin C only about 50 times tonight. Thank you very much.